Welcome back to the Takeout. Senate Democrats and those who caucus with them continue to demand binding negotiations with the White House on access to health care, Medicaid, and enhanced Obamacare subsidies before they will vote to end the current government shutdown. Here was Vermont Senator Bernie Sanders today on CBS Mornings.
Before I vote on a bill that will right now allow 50,000 people to die unnecessarily, I want it absolutely clear that that will not happen.
Administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz, joins me now. Dr. Oz, your reaction to Bernie Sanders?
I'm not sure what he's talking about. There's no program that I'm aware of that's going to lead to the death of 50,000 Americans. But what I will tell you is that a lot of the arguments made by the Democrats are all falling flat because the more we investigate their claims that there was no fraud, waste, and abuse in Medicaid, for example, which was a major focus of the One Big Beautiful Bill, this now called the Working Families Tax Cut legislation that the Senate passed. Bernie Sanders wasn't part of that, but enough of his colleagues voted for it that it became the law of the land, addressed a lot of this fraud, waste, and abuse. And we decided to go an extra step. And I want to announce that data here today with you. We asked investigators, and we upgraded the team doing this. We sent them out and said, find out how many people were actually getting Medicaid funding who were illegal immigrants, who were undocumented, weren't supposed to be here. Now, we were told that this wasn't happening. It turns out, there's a number. You ready for this, Major? $1.2 billion already in just the last few months were spent by Medicaid, go out of this agency, federal dollars, to support states who are paying for illegal immigrants. Now, this is maddening for a bunch of reasons. First, we were told it wasn't happening. So the One Big Beautiful Bill gave us the ability to go after this funding, which we're now doing. We're going to pull back that funding. In fact, some of the states are realizing that this is money that they were sort of caught red-handed taking from the federal government and are already refunding the money to the federal government. But it also heightens my awareness that there's a lot of misinformation being touted out there by Democrats arguing this is a good reason to close the government. I don't think you should close your government if what we're trying to do is protect taxpayers from having money sent without their knowledge to illegal immigrants in other states. As an example, California, which is responsible for a lion's share of that illegal immigrant funding, they offer free dental, free eye exams. Again, I'm not against those. But if you're going to offer those to Medicaid patients who are illegally here in California, you should not ask taxpayers in Texas or in Florida to pay the bill. Pay it yourself. But that wasn't how the deal was. They wanted to be really nice about this money until it was their money that needed to be spent to pay for it. And as soon as that became evident, they began to pull back on some of those services. So to Bernie Sanders and all the other Democrats arguing that they're shutting down government under false pretext, I want to call their attention to actual facts, on the ground knowledge that we are spending federal tax dollars to support illegal immigrants. We now have a study going in over half a dozen states. The numbers are increasing, and it's alarming. Thank goodness that law was passed. It should not be repealed in order to reopen the government.
So, Dr. Oz, terminology here is very important. And I've heard the states that you're mentioning, specifically California, say that the Medicaid money is separate from the state money that they have allocated for undocumented immigrants. You and other Republicans have argued that it's all fungible. But are you talking about direct Medicaid dollars going directly to undocumented personnel in California or some of these other blue states that have decided to use their own state money to provide these insurance benefits?
Major, yes, yes, yes. Okay. I was told exactly what you were told, that this is a commingling of dollars, not really. Maybe you're blaming us for some administrative costs, but that's not really the case. We're talking about actual dollars that were sent from the federal government to Medicaid in several states. It wasn't just California. And just to give additional credence to my claim, again, this is coming from federal investigators looking at Medicaid dollars spent in California. California has already rebated us several $100s of the money I'm talking about. And we're going to continue to take the rest of the money back because it's not theirs. It's the taxpayers' money. And again, I'm going to reemphasize this. If you're watching this program, and I don't want to pick on California, they're not the only ones that are guilty of this. But if you're in one of the many states that do not allow money to be spent for illegal immigrants on Medicaid, why should your tax dollars to the federal government be redirected to that exact purpose in a different state? It's a nation of 50 states. We should all agree on this issue. If the American people want us to pay for illegal immigrants getting medical care, I'll happily dispense those dollars from Washington. But until we do that, I should not be doing that very thing. And that's why this one big, beautiful bill was so important. It actually prevents people like me, because there'll be future generations of CMS administrators, from doling out money coming into the government from one state that doesn't allow illegal immigrant Medicaid funding to another state that decides they want to do it.
Dr. Oz, we're going to continue this conversation, not on this topic, but on pharmacy benefit managers, Trump RX, and Cost Plus, which is, as you know, run by Mark Cuban. But I want to play for you some sound today that was on CNBC from Mark Cuban about the administration's efforts to reduce prescription drug costs. Please listen.
Dr. Oz has been great. Like I would tell the Biden administration all this stuff, right? It just wasn't important to them. Some people it was. CMS, they had some great people there, but it just didn't get to the top, right? This administration, completely different. I'm not saying I'm a Donald Trump fan now, but credit where credit is due. They are trying their best to reduce the cost of prescriptions and of health care and of insurance.
And are they receptive to the
all this stuff, right? Yeah, all this stuff, right?
Do you think we'll see that?
No.
Why?
Because the PBMs and their insurance companies are too powerful.
So you heard the last part of that, Dr. Oz. No, it's not going to be successful. Pharmacy benefit managers, too powerful. Insurance companies, too powerful. But Mark Cuban, not a Trump guy, offering you praise for efforts undertaken thus far.
Well, Mark Cuban is a very competitive person, I know, because we both used to play in the NBA Celebrity All-Star games, and I'd have to guard him. He's sharp-elbowed.
Wasn't expecting that reference, but please continue.
But being a competitive person myself, we are going to succeed. And yes, he's right. There are powerful forces who benefit tremendously from the current system, or we would have changed it generations ago. But people like me, and there are many others, Chris Klump, Ana Hernandez, John Brooks, many others have come in the government because President Trump recruited us, because he's given us confidence, those of us coming from the private sector, that we can make a difference. It's a generational opportunity to do exactly what Mark Cuban was talking about, to address some of the shortcomings of the current system. And none of us are here for life. You know, I'm glad to do this job for a couple of years, proud to serve the president, and he's passionate about making sure that we don't slow down at all. He just pushes all the time. He calls and says, what's next? The most favored nation pricing is a good example of this. Everybody said it wasn't possible. I don't think anybody that I talked to who knew the space believed that we would be able to achieve what we've already done over the last few weeks, to announce that this country will no longer allow its citizens to pay 3 times more for the exact same drugs made in the same factory, put in the same bottles in this country, than those same drugs cost overseas. And we've effected that change with the leading U.S. company, Pfizer, the leading European company, AstraZeneca. Last week, a wonderful program with a subsidiary of Merck that actually does most of the fertility drugs in this country, that drops those prices. And now, Major, we're using most favored nation drug pricing to catalyze other changes in the healthcare system. Because once you bring down pharmacy pricing, the costs of drugs, all of a sudden you can begin to impact on how the pharmacy benefits management companies function. That's the group that Mark Cuban was speaking about, that he competes with his company. And they actually came to the table last week in the Oval Office and agreed to drop their costs so we can make fertility medications more affordable to the American people. That's the kind of catalytic shifts we are expecting and we're already seeing. And there are many others I can give you, but if you go to industry and say, listen, I've got a bat that I can use on you, I've got legal, legislative solutions here, statutory, I've got regulations I can pass, or we can sit down and have a real hard brass knuckles discussion about what's feasible. If you can do it yourself in a more nimble way, we'll support it.
I want to have you back here to talk about the brass knuckles and the practical realities that brass knuckles can sometimes achieve, even in the most difficult and cumbersome marketplaces. Dr. Oz, always a pleasure. Thank you, sir.
Same, Major. Take care.